Hey everyone, let's go ahead and talk about the Preservé breast preservation augmentation. So this is a little bit different than our traditional augmentation. So with the normal breast anatomy, you have the retaining ligaments, the support structures, the Cooper's ligaments that run around and actually through the breast. So with a traditional augmentation pocket, we're actually going in and we're cutting these a lot of the ligaments centrally in order to make a pocket to put the implant. With the preservation breast augmentation, instead of cutting those, we're actually inserting a device that has a balloon on the end of it, and we're expanding that. So we're expanding those ligaments, we're not cutting them, so we're preserving that, hence the name breast preservation. So you can think of this kind of as like a nest where you're putting the implant in, and it's held a little bit better, kind of like almost like an internal mesh, basically, that's your own mesh, so we're not having to add additional mesh. The implant is super strong, so I can stretch it, I can pull it, this thing is not gonna break. It's a monoblock design, so the shell on the outside is actually annealed to the internal cohesive gel. So this is really strong, which is unique out of the implant market. Here we're doing some of our preoperative markings. So you can see the borders of the breast, the medial portion where the medial cleavage is going to be, the lateral portion where we're going to get that nice lateral contour down into the chest wall. The upper portion where we're going to get that nice upper cleavage, that push-up bra effect. And you can see all the markings for the ligaments as well. So now here we are in the operating room. So we're tumescing. We're basically adding local anesthetic with ultrasound guidance. So we're doing this so we know we're exactly in the right plane. We're putting the implant right where we want it. It's also kind of guiding us where the implant is going to go. Here we are using our tunneler. So we're pre-tunneling, making a little narrow channel that's going to direct where the balloon goes. Here we are putting the balloon in right now. We're expanding it. So this is what really is the essence of the preservation breast augmentation. So we haven't cut any of the ligaments, we haven't cut anything. We've used a really teeny incision, and we're inserting that, we're inflating it. Now we remove the balloon and we're putting in the implant. We're using what's called a Keller funnel. It's basically a sterile pastry funnel that lets us squeeze a large implant through a small space, get it through that tiny little incision and get it right in there where it's sitting nice. And then we're done. Here's our final result. She's now at 3 weeks out and she is looking absolutely fantastic. So she has nice cleavage in the midline. She has great upper pole fullness, that nice push-up look, great size, great volume, not too big. A perfect mix between size and contour. See y'all later.